I'm Yesenia Taveras, and welcome to La Conexión, The Connection, a television show that seeks to connect the Hispanic community to programs and services in support of them. On today's show, we'll be taking a look at the expansion of Henrietta Johnson Medical Center, domestic violence and how it affects the Hispanic community, and there's a health fair on April 6th that's going to benefit individuals with special health care needs. But first, I have here with us Rosa Rivera, who is the CEO of Henrietta Johnson Medical Center. Welcome to the show.
Thank you for the invitation, Yesenia. It's a pleasure to be here.
Thank you for coming. And to start off with, can you tell us a little bit about the services Henrietta Johnson Medical Center provides?
Sure. Henrietta Johnson's been around for about a little bit over 40 years. We have an array of services, starting with family medicine, where we see everyone from pediatrics to geriatrics. We provide screenings, treatment for chronic disease, immunizations, GYN, physical exams, cancer screenings. We also have a pediatrician on site. We have a women's health department. We do annual GYNs. We have a dental department. We do screenings, extractions, root canals. We have social services, podiatry, and financial counselors.
And how about the patients who are uninsured? How do you go about helping them?
Patients that don't have insurance, we do have a sliding fee scale. We take a look at their financial status. We look at their income and family size and determine where they may fall. And based on that, they'll pay a percentage of the visit, or they'll pay something as minimum as $20 for their visit.
And for the undocumented individuals, can they still receive services at one of the Henrietta Johnson Medical Center sites?
Definitely. Legal status is not something that we check on. And for the undocumented, we will take into the same process. The exception to that will be if there is a program where we know ahead of time they will not qualify because of their status, then we will not make them go through that process. An example of that would be Medicare or Medicaid. So if they don't qualify, we don't take them, but we'll try to see what they're eligible for other than the sliding scale at the office and help them get through those programs.
And now Henrietta Johnson Medical Center has undergone a huge expansion in their Southbridge location, and now you have a new facility in Eastside. Can you tell us a little bit about this?
Correct. We went through a huge expansion at the main facility. It was a $2.3 million expansion. To keep parts of that was expanding the dental department. We went from 3 chairs to 10, and then expanding the women's health services as well. And what that has allowed us to do is to get patients in the clinic much faster. Before, for example, in dental, there was about 3-4 months wait. People can get in there much faster. By doing that, it also allowed us to increase services on our family practice because we moved some of those patients from there. And then the East Side clinic that we opened up, which is a great facility where we have a family medicine, pediatrician, podiatry, and we also have a lab and dental services.
And what was the process in choosing a facility at Eastside rather than any other part of Wilmington?
Well, Eastside is a project working together with 2 partners, which is Children's and Families First and the Christina School District. And the whole idea came about from a program that they were starting about addressing the needs of the schools, the elementary schools in the area. And out of that came the idea of that the students needed some local health services, and so did their parents. So we talked about it. We said, this is a great program. Let's look about it. This Christina School District has been fabulous in terms of the location. Children's and Family First were there in terms of structure, help us with the resources, identify the funds to renovate the space. So it was a really great partnership, and based on the needs of trying to improve not only the academic status of the children, but also their health care as well.
And speaking of children, Henrietta Johnson Medical Center recently received a grant. Can you tell us about what the grant was and where the funds are going?
Sure. NextGen granted us some funding to take a program that we have that we currently do on site, which is the FAT program, Promoting Healthy Activities Together, taking that program actually to the schools and doing it with the young ladies at the school. The program models a 5-2-1 almost none program from the Moors, and then we have a dancer that goes in there and does 1 hour dance within physical activity. So taking that program to the young ladies at the schools rather than have them coming to the health center. So the funding's been grateful.
And how does the community benefit as a whole by having a medical center like Henrietta Johnson?
Oh my goodness. The idea is that you have the access local. You have your access right there. We're trying to minimize people having to go to the emergency room and utilize the emergency room as their primary care. That's what we're there for. Besides having the services on site, we also have doctors that are on call 24/7. So if we're close, you can call us and we'll direct you on what you need to do. So it benefits because it brings the services directly to the community, reduces the emergency room utilization, and hopefully we're improving the health outcomes of our patients in the community, which we know we have high incidence of diabetes, hypertension, and those types.
And for the Hispanics who don't speak English, as Spanish is their only language, how do you go about helping them with your services?
We don't have any providers right now that speak Spanish, but we do have staff that is bilingual, Spanish, Italian, French. They're there in the office to help them with those services, but we also have what we call the language line. So any other language, or if a person that doesn't speak, that's not bilingual, can access the language line and help those patients through the process.
And is there anything we can look forward to for Henrietta Johnson?
Oh, yes, we're thinking about a third location should be coming up soon, maybe in a year or so. So we'll continue to expand, looking at opportunities where we need to be in terms depending on the needs of the community.
And one last thing that I did want to bring attention to. You said that there is a dedicated physician at both locations. Can you tell us a little bit about the dedicated pediatrician that you have at your East Side location?
Oh, yes. Dr. Burlingame, a wonderful pediatrician that is at the East Side School. He's already there. He started seeing patients, and he's there to do well child visits, sick visits, immunizations, physicals, sports physicals. So if you do not have a pediatrician, you want to come and make an appointment and see him.
And I want to shed some light on the benefits at the East Side location, because now you have a pediatrician there, and if a woman wanted to go there, you have a OBGYN.
That's correct.
And then you also have your dental. So can you talk about having that type of access all in one facility?
The idea is that you want to have as many services available in one facility as possible, because you want the entire family to be taken care of. So you have the pediatrician because you want the children to come in. You have the family medicine doctor, you want the parents to be taken care of. Then dental is a big need for both children and adults. So we have these dental services there as well. So we have a lab on site. So we're trying to connect as many services in that location so the family can come in and they all can be treated and be seen within one space.
Wonderful. Well, Rosa, thank you so much for giving us the opportunity to receive all this information from you.
It's been a pleasure. Thank you.
Thank you. And please stay tuned for we'll return after these short messages.
No están nada mal.
¿Y qué tiene de raro? Bueno, la práctica hace el maestro.
No tienes que ser perfecto para ser un padre perfecto. Hay miles de adolescentes en foster care que no necesitan perfección, te necesitan a ti.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Every 9 seconds in the United States, a woman is beaten or assaulted. Domestic violence continues to tear his family apart, leaving in its path emotionally, physically, and spiritually injured women, men, and children. To better understand how domestic violence impacts the Hispanic community, I have here with us Leticia Figueroa, who is the Domestic Violence Coordinator at the Latin American Community Center, and Maria Beatriz Hennessy, who is from Canada but currently interning at the Latin American Community Center. Welcome to the show.
Thank you for having us.
First, Leticia, can you tell us what is domestic violence and some of the signs to look out for in an abusive relationship?
In an abusive relationship, first we start with the controlling, the jealousy. It may be insults, it may just be gestures, and then we start seeing physical aggression start to increase, sexual, physical, sexual, emotional, and also if we see a friend of ours going through this, we would see her a little more prone to accidents, bruises, cuts. And in children, we would see slowly aggression, isolation from friends and social activities. So little by little, you start seeing more signs of domestic violence.
And as some of you may know, in the Hispanic community, domestic violence is a huge problem. Mm-hmm. And if I was, for example, a wife who was undergoing a domestic violence case, and I didn't want to go directly to the police officer, but I wanted to seek some services, and I came to the Latin American Community Center. Can you kind of tell us a little bit about what a meeting would be like?
Sure. First, we would do a domestic violence evaluation to see where you are in terms of what you want to do and what services I can provide for you. Currently, my services include a women's support group, case management, a safety plan, intervention in times of crisis, safety planning, legal assistance, and therapy referrals.
And now, although you're not therapist, mm-hmm. you will help guide the individual who comes to seek services. What do you do for the undocumented individual who is going through the same problem but needs help?
Well, the most common misconception is that they can't call 911 or have the right to, and they most certainly have the right to call 911 and file a police report. They also are eligible for either a U visa or a VAWA. A U visa meaning both people, the abuser and victim, are undocumented, while the VAWA is when one is either a resident or a citizen of the United States and the other one is undocumented.
And being a victim of domestic violence, we have here with us Maria, who is going to get her certification for victimology. Hello, Maria. Can you tell us a little bit as to why you chose the Latin American Community Center as your place for internship?
Well, since I'm originally from Colombia, since I moved to Canada, I didn't have any opportunity to work with Spanish-speaking individuals. So when the time came for the practicum, as part of the program, I was thinking that it would be in my benefit and benefit for also the Spanish community to offer my knowledge and services to the Latin American community. So through some friends, I managed to get some connections in the States, because unfortunately in Canada we don't have a service like the one offered by the Latin American Community Center. And they saw my credentials and I'm here.
And what are some of the differences you've seen in victimology comparing Canada and Delaware?
I wouldn't say in victimology per se. What I have seen and I have observed here is that you have pieces of legislation that are very beneficial for the victims. For instance, we don't have in Canada the protection for abuse. We don't have the Violence Against Women Act. We don't have the Trafficking Victims Protection Restoration Act. Those pieces of legislation certainly give some rights to the victim to go against the perpetrator. So that is a discovery for me. In terms of services, well, here in Wilmington, in Delaware in general, the victim advocacy services are amazing. I mean, there are many sources and resources for victims, not only for domestic abuse, but victims in general.
What are some examples of victimology?
Well, let's start by defining what is victimology. Victimology is a new field. We separate from criminology. and we focus in the understanding what is victimization, the need, and the support that we can provide to the victims.
And now, is this something that happens mostly in the Hispanic community, or does it affect anyone?
Being a victim could be, anyone could be a victim. I mean, crime doesn't discriminate against. In any given moment, anyone can be victimized, regardless of color, race, cultural background, social or economic status.
And with dealing with the Latinos at LACC, what are some of the experiences you've gone through recently, right now, that you feel is going to help benefit you in completing your certification?
Well, perhaps for me has been the understanding the effect of victimization, how culture, because part of our values and beliefs are part of our culture, how those values and beliefs will affect the process of victimization, because victimization is a process. So the way that we go through the process has to do very much with what we believe in, those values and norms that we have very much embedded in ourselves.
Well, Maria, thank you so much for taking the time to join
you.
us here on our show, and Leticia as well. I wish you best of luck in completing your certification at the Latin American Community Center. And for those of you who are watching, please stay tuned, for we'll return after these short messages.
$7,000 estudiantes de secundaria abandonan la escuela todos los días. Esto forma una línea de más de 4 millas de largo. Podemos mantener a los estudiantes en la escuela. Visita boostop.org y toma el primer paso.
$7,000 high school students drop out every school day. That's a line of desks more than 4 miles long. We can keep students in school. Visit boostup.org and take the first step.
Caring for a child with special health care needs or disability can be challenging and emotional. Parents and caregivers of children with special health care needs typically struggle to find resources and services to help them. However, there is a health fair on April 6th that will link services to these families. And to further discuss in detail, I have here with us Marta White, who is a member of the Board of Directors of the United Cerebral Palsy of Delaware. Welcome to the show.
Thank you very much. Thank you for having me.
Well, thank you for coming out. Now, in regards to the health fair that's coming up, can you tell us the importance of having an event like this?
It is very important because many people do not avail themselves of all the services that are available for them, for children with disabilities or children with special needs. At this fair, we will have many vendors who will be able to provide services or connections or links to all the services and products that are available in this area.
Now, if I was a parent who child has a lot of special health care needs, I'm going through a emotional struggle here. I feel like, you know, there's no program out here, there's not an organization that can help me. However, can you tell us about the different type of vendors that are going to be at this event that will be able to help these type of families? How many vendors do we have? What type?
There will be probably between 60 and 70 vendors. There will be organizations, there will be therapists, There will be people who provide mobility, like in vans and automobiles. There will be many vendors. Some of them will hold presentations and demonstrations. There will be a demonstration about food allergies, which is quite a concern for parents of children with food allergies. There will be a presentation also by Able Arts, who they have actors and singers with disabilities, and they will do a presentation. And there will be many activities too for the children, but mainly it will be vendors who will have will provide information, links, products, all kinds of information for the parents of children.
And what's the name of this health fair?
It is the health fair. It is done by United Cerebral Palsy in conjunction with Brain Injury Association of Delaware. It will be held April 6th at the DoubleTree Hotel from 10 to 4. It is free, open to all public, and parking will be free, also validated by the hotel.
And that's the DoubleTree Hotel here in Wilmington?
Right here in Wilmington, yes.
Okay, and in regards to the health fair and the vendors that you spoke of, although your main focus is for the children who are suffering with food allergies, might be disabled, parents can attend, and by them attending, is this an event that you feel will help them to network?
Oh, definitely. It is a very important health fair. It will provide much information to the parents, a lot of it which they're not aware of.
And so can you tell us a little bit about how your organization decided that there was a need for this in our community, to have a fair like this?
We felt that parents of children did not have enough information about everything that's available to them. So
are you expecting a huge amount of people, a big number of people to attend?
Yes, we're expecting a lot of people to come with, you know.
And with that being said, are you going to plan on having a fair like this in the future?
Yes. We're going to have one in Kent County next year, possibly Sussex County too. No date has been determined yet, but yes, the plan is to have them in all 3 counties of the state of Delaware.
And you said there's going to be performances, activities for the kids, so this is not only a program where the parents will be able to network, but children will be
it'll be fun for the children too, yes. There will be an activity room, there will be face painting, and there will be information also about our camp. We run camps for children with disabilities in the summer. This year, Camp Benito, our camp in northern Delaware, will run from July 1st to August 9th, and there'll be a lot of information about that too.
And regarding the health fair and the camp that you just mentioned, can you tell us a little bit about the importance of these disabled children or these children with special health care needs, the importance behind them socializing with one another?
Oh, it's very important. Our camp is open to children with and without disabilities. And by being in camp together, they learn about each other, and they learn, children without disabilities learn the limitations that children with disabilities have. And it's important for both of them to be together. And the camp is fully accessible, of course. We have a fully accessible pool. We have sports. We have arts and crafts. We have visitors that come. Sometimes we've had the state police come in with their canine partners, and we've had mounted police come with their horses. So it's interesting for the children.
And what are some of the goals that your organizations hope to reach? Your organization and the organizations that are affiliated with this health fair, what are some of the goals?
Our goal is to reach as many people as possible in the whole Delaware Valley so that they know what they have available for them and not have to struggle alone.
Right, and speaking of alone, can you tell us a little bit about some of the struggles that you've witnessed yourself where these parents are going through not being able to find a resource, a service, a program?
Oh, yes, I've seen parents who really do not know where to turn when they need certain services or there are a lot of people who don't know what's available out there for them.
And your organization having this
Yes.
fair will make this available to them.
Right, yes.
And is there any information for the Hispanic community, because this is a show that's trying to connect the entire Hispanic community. So on La Conexión, we provide an opportunity where if there's something important you would like for a Spanish-speaking only audience to
Yes.
understand, this would be the time to do that.
Okay, yes. Presentamos una feria de la salud muy importante para los padres de niños con discapacitaciones y con problemas médicos. La feria será el 6 de abril en el Hotel Doubletree de Wilmington, y desde las 10 de la mañana a las 4 de la tarde. Es gratuita para todo público y el estacionamiento del carro será gratuito también, validado por el hotel. Así, mucha información para los padres de niños discapacitados.
Y muchas gracias por esa información.
De nada, de nada.
And thank
Mi
you so
placer.
much. Thank you so much for coming out. I really appreciate this. This is going to help a lot of families out there who feel that there's not a program or voice to be heard, and at this event it will be.
We hope so. Thank you.
Thank you. And stay tuned. We'll be right back after these short messages.
No es su nuevo grupo de amigos. No son los videojuegos. No es el barrio.
Mamá, tengo que ir a la escuela hoy.
La mayor amenaza al futuro de sus hijos podría ser usted misma. Cada día que faltan a la escuela, incluso a la escuela media, pone en peligro su graduación.
It's not his new group of friends. It's not the video games. It's not the neighborhood.
Mom, do I have to go to school today?
The biggest threat to your child's future could be you. Every day they miss, even in middle school, puts their graduation at risk.
I hope you've been able to take away some great information from our guests today. For example, the Henrietta Johnson Medical Center and its expansion for over 40 years have been offering quality medical and dental care to the citizens here in Wilmington. And domestic violence being such a huge problem in the Hispanic community, and with over 10 million children witnessing this within their own family, I hope you've been able to better understand that there is a place to go to find some services, to find some resources, to find some help. As an example, the Latin American Community Center. You're not alone in this. And having said that, if you have a child with special health care needs or is disabled, please attend the event, the health fair event, on April 6th at the Doubletree Hotel. This is going to be an opportunity where you as the parent or the caregiver will be able to connect one-on-one with other parents and caregivers who are going through the same emotional challenge you are. And the children will benefit from all the activities that are there, their performances, and socializing with other children who are just like them, since on a regular day-to-day basis they might be isolated from those children who are not disabled or have special health care needs. From all of us here at WITN Channel 22, I'm Yesenia Taveras. It's been a pleasure, and thank you for watching.